Welcome to This Week in South Carolina. I'm Gavin Jackson. As COVID-19 continues to spread throughout the state, country, and world, schools and establishments are being forced to shut down in this crisis. People are being asked to social distance themselves, and the economy is lurching. So how is the state coping, and what do you need to know to protect yourself and your family? We have the latest from this week. At this time, the COVID-19 virus has infected more than 11,000 Americans and killed 154. Hospitals are taking precautions, including Lexington Medical Center, which is screening respiratory patients outside of and separate from its emergency room as a precaution to prevent spread. Drive-through testing is provided in other areas, and patients can be pre-screened via telehealth. Kershaw County has been hit hardest by the virus, with community spread being detected there on March 8th and being home to more than 25 cases among the 14 counties that currently have cases. Local leaders there addressed the community's response earlier this week.
Our small community finds itself at the center of this storm. But we know this: we will emerge only stronger and only more united.
State epidemiologist Dr. Linda Bell continues to provide updates on the disease.
On behalf of all South Carolinians, we want to express our deepest sympathy for the family and loved ones of this patient. This loss is a reminder of the importance of taking precautions to protect those at higher risk, like the elderly and people with serious underlying health conditions from exposure to illness. As South Carolina's lead public health authority, our top priorities remain preventing the spread of disease and protecting the public's health. We know that many South Carolinians are concerned about what impact the virus may have on themselves, their loved ones, and on our state. We are currently only seeing ongoing transmission in one county, Kershaw County. We want people to be prepared and to remain calm and rational as more cases occur. Recognize that the majority of illnesses are relatively mild, the type of illness for which individuals may not normally even seek medical care.
Another big shift in the way of life in South Carolina was the closure of schools.
I first want to assure all the parents of school children in this state that we are still in a partnership, and principals, superintendents, teachers are working together as we speak to prepare to continue instruction for your children, and also to be sure that those who need to be fed will be fed.
That one was a snap.
Across the state, schools were ready to respond as teachers began shifting coursework online in some situations and sending it home in others. Cafeteria workers and bus drivers mobilized to ensure students remained fed.
So today it's white milk, chocolate milk, and juice. They don't get a choice with this. They don't get a choice because the white milk goes with the cereal and the chocolate milk goes with lunch.
In Kershaw County, the scene was of organized chaos, with carts stacked with boxes of bagged lunches and coolers filled with milk, ready to go out to thousands of students every day.
So today, and until the kids get ready to go back to school, we're going to be delivering lunch and breakfast to our regular bus stops. But any kid under 18 can come and get lunch or breakfast. Well, lunch and breakfast. And I mean, honestly, it's actually good because, for some kids in the district, this is their only mean of food. It's from the school and stuff like that. And at the same time, this is a lot of kids' only positive atmosphere is the school. So to see the kids' faces, put a smile on their face, also put food in their stomach, it makes me excited.
Meanwhile, the state and federal government cracked down on what older kids can do.
I want to speak particularly to our largest generation now, our millennials. I have the mom of two wonderful millennial young women who are bright and hardworking, and I will tell you what I told to them. They are the core group that will stop this virus. They are the group that communicates successfully, independent of picking up a phone. They intuitively know how to contact each other without being in large social gatherings. We're asking all of them to hold their gatherings to under 10 people, not just in bars and restaurants, but in homes. We really want people to be separated at this time.
However, in South Carolina, things continue to change slowly, and people still gathered in groups at bars on St. Patrick's Day in Sullivan's Island, though that changed later that day.
Restaurants and bars, now this is a requirement, restaurants and bars must close their dine-in service starting tomorrow. That is, tomorrow morning, no more dine-in service.
Greenville was already moving in the direction to close bars and restaurants, But with the governor's order, it meant last call in the Palmetto State and in places like 5 Points in Columbia. With the University of South Carolina on spring break and schools closed for at least until the end of the month, the scene was scant even for a Tuesday night in 5 Points. Some were craving just a little bit of normalcy as times begin to change, though many understand the risks.
I'm honestly not extremely worried about it at all. Kind of like my friend Marcus said earlier. I haven't really been worrying about it too much because most of the time I'm at home or I'm at work. I only come out once a week anyway, and it's to hang out here at CJ's. I do understand the shutdown though, the curfew that they've implemented. Simply because there are a lot of older people that do like to come out and have a good time. And I'd hate to see any of the people that I care about get sick.
You know, a lot of these things are going to cause problems for businesses, but the enemy we face, this enemy of this virus, is bigger than any sort of irritation or inconvenience that any of us could have. So we are asking people to stick together and understand that we're in a crisis and we need to take these measures.
Dwayne Parrish said it's too soon to tell how bad it will all be on the economy.
It's already in effect. I mean, it is businesses dramatically gone down. This week, I expect hotel occupancy statewide to hover around 20 to 30%. This time of year normally would be 70%. So a lot of these hotels are small businesses. Same for restaurants, same for bars, same for attractions. This is a difficult time for people. This is normally spring when, the temperature warms up, the rain stops, and the spring flowers come out, and people travel a lot, and that's obviously been dramatically diminished. And so, we've got our work cut out to A, get through this, and B, bounce back as quickly as we can. No, this is all uncharted territory. I've never seen anything change so quickly in my life, from one day to the next, and literally in some cases from 1 hour to the next, how much the world can change. And unlike a hurricane that hits the coast, it has a defined area of some sort, at least on a spaghetti model. It has an end date, it's going to stop. Hard to see the end date right now, and it's like a hurricane is hitting the entire country, or in some cases the entire world. And so it has affected domestic travel, global travel. It has hit nearly everything it could.
The ripple effect will soon be felt in state revenues, and with little more than 3 months left until the new fiscal year starting July 1st, it's unclear how the $10 billion House-approved budget proceeds in the Senate.
Because let's face it, the world's different than what it was 3 weeks ago. The revenue estimate that the House passed that budget on, it's gone. You might as well just rip the whole thing up. We have a shutdown in our nation. We're having a shutdown within our state. We've got small businesses that don't have customers. We've got restaurants that don't have customers. We've got hotels that are empty. The revenue estimate for the state of South Carolina is nothing close to what the BEA said just 3 weeks ago. And we don't know how much worse it will be. The second quarter of this year, the revenue estimate is going to be way off than what the BEA projected. We might even have a shortfall in this year's budget. And to be able to move forward collectively as if the economy hadn't been affected would be one of the most foolish things this General Assembly could have ever done. We need to understand what the economy is going to look like. And right now, we don't know. We're not going to know that in 2 weeks. We're not going to know that in 3 weeks. And I don't know how we build a budget going forward if we don't know what our revenue estimates will be.
But there are millions in contingency reserves, which senators tapped to fund a $45 million emergency funding bill that will fund critical staffing and equipment needs over the next 6 months, according to DHEC Director Rick Toomey.
The two things that I'd like to echo a little bit on Senator Sheheen's comments would be the first, the strategic national stockpile is almost a one-time event. And so, yes, we're concerned also. Once we draw down those resources, there's no more going back to the well. And so hopefully those resources buy the nation time to ramp up the supply, the manufacturing aspects of what is needed, not only in Kershaw, but needed in every county in this state and every county in every other state across the nation.
In the Senate, at least one senator, Margie Bright Matthews, a Democrat from Colleton County, expressed her concerns about the ongoing pandemic as the debate over a continuing resolution remains stalled.
Do you have any information whether or not that campaign will include whether DHEC is going to come into our chamber and the House chamber to make sure that it is properly sanitized and taken care of so that we will be okay?
Meanwhile, the House passed the emergency DHEC funding bill Thursday, and Governor Henry McMaster signed the bill immediately, sending that money directly to DHEC. Joining us to discuss COVID-19 and what you really need to know is Dr. Melissa Nolan, a professor at the University of South Carolina's Arnold School of Health. Thanks for joining us.
It's my pleasure to be here.
So, Dr. Nolan, when we look at what's going on right now, it's somewhat uncertain times, pretty unprecedented. I want to kind of get your perspective when we look at past pandemics, past big flu outbreaks, for example. How is this one different what we're seeing right now? What makes it so unique at this time?
You know, with every pandemic, it can be very concerning when you have a novel pathogen. So this is something that we've essentially never seen before, which means that as a human species, we have no immunologic history. So in essence, anyone could be susceptible. And as we're seeing over the last couple of months, as this is unfolding, we're learning more, but what we're learning could change daily and even hourly sometimes.
And when you talk about not having that immunity to it, is that what maybe makes it different from the flu? Talk about how people keep comparing this to the flu and maybe why that's not the case.
Sure. So I think it's natural to compare this to the influenza because most people are familiar with that. And it's another very common respiratory infection that we see in general circulating in the winter months. So with influenza, we see a little bit of a change from year to year. That's why you needed a new flu vaccine every year. But similarly to this pathogen, every once in a while, it can change very quickly. Those antigens shift and we see a new pathogen that can be very dangerous for people. And that's an example of what happened with the 2009 H1N1, which also became a pandemic. However, one of the biggest differences that we see from kind of 2009 H1N1 versus this one is that fortunately it doesn't seem that young, healthy people seem to be particularly susceptible to severe disease.
And so you're talking about winter months versus warmer months.
Yes.
CDC is saying we don't know this might change when it gets warmer outside. Tell us people about like what makes the difference there when it's warmer versus cooler weather and disease and how it spreads in general.
It's essentially a very basic principle. When it's cold outside, people tend to aggregate indoors, right? There's also the phenomena that the heating that we use inside can dry out those mucosal membranes, making you more susceptible. So in the summer months, especially here in Columbia, South Carolina, it's incredibly humid, which just makes it a little bit harder for that pathogen to take hold in your system. So what I think will likely happen is that it might die down a little bit in the winter months again, or in the summer months, mostly just because people are going outdoors a little bit more and again, not having that dried out system. But it could possibly pick back up and we'll still see transmission occurring in the summer months. It's not going to go away completely.
So what are people asking you right now, Dr. Nolan? I know a lot of people have been kind of bending your ear. I mean, are they asking you when this is going to end? I mean, what the future looks like for South Carolina, when we might see this surge? I mean, what are you expecting? What are you maybe looking at right now to determine what we might be seeing in the near future and in the long-term future?
There's certainly some really important decisions that need to be made, whether or not the university is going to come back, whether to delay graduation, for example. We don't know what's going to go on with the school systems, with work in particular as well. I mean, there's a lot of kind of uncertainty right now in this time.
Why is that? Why can't we look at any modeling and maybe base it off of numbers we already have?
So we do have some decent models out there which can predict, saying initially before we kind of went into what's happened in the last week with all these new mitigation techniques, thinking that it might peak around April, late May. I would say now that we're trying to flatten the curve and extend that out, I think it's going to be potentially at least through the end of the summer, if not even into the fall.
So when you're talking about flattening the curve, I think a lot of people have probably heard that, but what are they trying to do with these techniques, these social distance measures, these self-isolation measures? What's really the end game? And when we look at other places like New York and San Francisco, these shelter-in-place measures going on, people in South Carolina might think, oh, well, we're a small state, I'm in a small city, I'm in a small town. This doesn't really affect me. I mean, why should we be taking this as seriously as people in these higher density population cities, or can we still see our friends? I mean, how do we adjust to that when we see all that on cable news and here I'm in South Carolina, it's a little bit different?
Yeah, it's an important question. The reality is we probably aren't going to lessen to a large extent the number of people that are going to be infected through this. What we're trying to do is stretch it out so that we can have those healthcare resources available. So as we are hearing now a little bit more in Italy, how they were having to make these big decisions, that they had more people needing ventilators than they had ventilators available. So we're trying to keep the number of people consistently under the threshold of what we have available resources, so that when people do get infected and if they develop severe disease, we have the capacity and the resources to take care of them.
And one study that I did see come out that I think has maybe helped shift some tones in the administration and others and become more aggressive on these mitigation strategies was the Imperial College of London issued a pretty dire modeling study that looked at if we didn't do anything, which is not the case, but if we didn't do anything, about 2.2 million Americans would die. But we have been mitigating that, so that numbers could be dramatically lower than that. But they said unless we do a major suppression strategy, which would be really hunkering down, self-isolating, really making sure everyone's where they need to be until a vaccine shows up, and that could be months from now. I mean, so how do we, is there a sweet spot in between there, or is it basically we're in this for a long time until a vaccine does show up to help really immunize everyone from this?
Yeah. Gosh, doesn't it feel like we're in a suppression time
Yeah.
right now? I mean, this is definitely unprecedented in the reaction that has been going on a community level. I would say the goal for us is to just try and limit your contact as much as possible with anyone that could be sick, and as it's recommended, just lowering the amount of everyday kind of contacts that you have. It's been estimated that in normal conditions, we could have up to 200 new contacts every day, of 3 new contacts in particular, but 200 overall. And so really just trying to limit that so that we can slow the transmission of this disease.
When you look at South Carolina numbers, I mean, we're at 60 right now as of this taping, 60 cases, 1 death. They've been steadily growing. Have you been able to deduce anything in terms of how those numbers have been going up, or you really can't pinpoint anything at this point, just the fact that they're going to keep going up? I don't know how, like the multiple at this time, if it's been doubling in a certain amount of days, but is there any indicator that you're looking at particularly that we should be aware of?
So with models, there's a lot of different variables and assumptions that go into that. And again, the challenge is that we're changing so quickly the way that we're handling this, the number of people that are getting infected, the transmission sources, and all of that goes into the models. So it's hard for us to predict that. What I can tell you is that the National Science Foundation has put out a call for researchers to come up with these sophisticated and accurate models. So I wouldn't be surprised if we could start seeing better models coming out in the next couple months.
And when we look at testing, I mean, with any pandemic, any major situation, you want better testing. How would you say the response has been, and are we too far behind the curve at this point, especially when you compare us to places like South Korea, who had, they were just ramping up from the beginning, versus America, who they had the same case discovery at the same time, essentially, but when you look at how the testing panned out, dramatically different. Is that going to put us at a pretty big disadvantage going forward?
It's unfortunate that we've had issues with testing in the beginning. And so essentially what happened, and is likely still happening a little bit, but hopefully changing, is that we have to prioritize the people that we test. And so with that, that means that we have an idea of who we think are the highest risk people or the highest priority to test. But because of that, we're missing potential new epidemiologic aspects of this. And so, by not testing younger people, we could be possibly missing that there's an important component of how they fit into that role. But fortunately, it's my understanding that we're seeing a change, that there's more testing coming available. It's now being set up. I know MUSC is able to do their own. They're up and off the ground. And then we're having commercial laboratories also being done. So it's not necessarily all going through DHEC anymore. So I would say I think it's a very bright chance future for us that anyone that wants to get tested will be able to get tested and won't have to be prioritized.
And to that vein, though, people with who are asymptomatic. I mean, are we going to get to a point where people are pretty much, like you said, everyone's being tested? I mean, or the turnaround of these tests is to be quicker because some people are waiting several days. They're doing a battery of other tests to make sure that they don't have the flu or strep throat, and then it's okay, well now we'll test you.
Sure.
I was just wondering, if I want to get tested, I have no symptoms right now, but could I just go and get a test? When are we getting to that point, and will that make a difference when we can test people that are asymptomatic?
Yeah, I think that's $1 million question, right? As an epidemiologist, there's certain key principles I need to know, and some of those are, what are the asymptomatic rates? So for every one person infected, how many others that might get infected are not going to show any symptoms that could be reservoirs of this? And we just don't know that at this time. And I think we have to prioritize, and the most important thing is to make sure that those that do need it have access to health care, and then understandably the studies and the research will come after.
And talking about other measures people are taking, do people need to be wearing masks? Do I need to be wearing gloves when I'm out? I mean, I know they say social distance and that I should be working from home, but for me, for example, I'm out a lot covering what's going on right now. Should I be wearing a mask? Should people that have to go to the grocery store wear a mask? What is your advice to these people that have to be out and about?
And at the end of the day, that's a personal decision that we all have to make. It all depends on which loved ones you have that might be susceptible to severe disease. So if you're a caretaker to an elderly parent, or if you have a child that has an immunocompromising condition, you might want to take extra precautions and really consider some of those measures that you mentioned. I would say for the general public, though, the best thing you can do, wash your hands for 20 seconds. Limit your contact with those that are sick.
And then also, this disease lives on surfaces too, so it's...
Cleaning surfaces,
yeah.
Absolutely. I would say there's a great information from CDC about what you can do to protect yourself.
And how are you personally handling this whole situation? You're working from home, you said you have kids you're dealing with at home too. How's it going for you, and maybe any advice that you have for parents working from home too at this time?
Oh my goodness. I have a 9-month-old who I just adore, and he's the light of my life. And it has been a challenge to work from home and have him at the same time. So I would say, parents, whatever you can do to get through the day.
Yeah, I can definitely see that, especially when everyone's probably calling you up asking you what's going to happen next, and you're like, we're all in this together at this point.
But it's true. I mean, I definitely want to limit the number of people that are around him. I think that's what everyone would do, right?
Gotcha. Dr. Nolan, thanks for joining us. Telehealth has become a vital part of identifying this disease. Our telehealth team looks at what the Medical University of South Carolina is doing during this crisis.
MUSC is extremely well prepared from the leadership level down. And that's apparent if you look on MUSC's webpage, right? So there's a ton of information already from leadership for our patients and employees. From our division, we have a coronavirus working group, and we've put together a training module for healthcare workers with regard to identifying patients under investigation and correctly identifying personal protective equipment and how to correctly obtain specimens, et cetera, so forth and so on. MUSC is very prepared. Also from the telehealth perspective, we're working on that platform. Telehealth is a extremely logical solution to a public health concern like this. We're talking about a highly communicable disease. It's highly transmissible. And particularly when you have a group of people that are susceptible with a few infected people, like say in an ER, there's going to be a high rate of transmission. So R0 is a number that we use when we talk about the transmissibility of infectious agents. It doesn't necessarily tell you how severe or pathogenic something is, but it gives you an idea of technically the number of secondary cases that would be produced by one infective person to a crowd of susceptible people. So a perfect example is measles. Measles has a very high R0, it's like 16, right? So one infected person in a sea of susceptible people can be expected to infect or to cause 16 secondary cases. So that's a big deal when you're talking about doing mathematical modeling and projecting an epi-curve. For, say, coronavirus right now, that number continues to change, right? This is a dynamic scenario, and those calculations are continue to fluctuate a little bit, but it's somewhere between 2 and 4, is what it appears to be right now. The beauty of telehealth and all of these telehealth platforms is that we can remove that element of transmissibility through close contact, which is defined as less than 6 feet, by seeing to patients remotely. And patients can be in the comfort of their own home, I can be in my office. I think encouraging people to use these telehealth platforms, keeping them out of the ER is extremely important. But that's a great way to be seen if you don't have a primary care provider and get medical attention if you have a mild upper respiratory illness.
To keep you updated throughout the week, the South Carolina Lead podcast will be regularly releasing episodes related to the crisis in South Carolina. You can find those on southcarolinapublicradio.org and wherever you find podcasts. News of COVID-19 is rapidly evolving, so we are here to bring you the latest and most pertinent information that you need to know. We leave you tonight with the most trustful places to get that information. From the Kennedy Greenhouse Studios on the campus of the University of South Carolina, I'm Gavin Jackson. Be well, South Carolina.